Today we're doing the human sternum, ribs, and hyoid bone. We'll begin with the sternum. The sternum has three parts. The top part is called the manubrium. There's a suture that connects the manubrium to the next part, which is the body of the sternum or the sternal body. That suture is called the angle of Louis. And we use that angle of Louis as a frame of reference to do physical examination on the patient. When we're using the stethoscope to do a heart examination on a patient, we're going to palpate and feel for that juncture, and we're going to take that stethoscope and we're going to move either to the left or to the right, and we will automatically be placed in the second intercostal space. We want to be in the intercostal space so that we can hear the heart sounds. If we have the stethoscope over the ribs, the heart sounds will be muffled. So we have the manubrium, the angle of Louis, the body of sternum, and the xiphoid process. When we do CPR, it is best to run your hand up the ribs, go above that xiphoid process, and then place your hands on the body of sternum. We're compressing the sternal body in order to compress the heart underneath, which is in the mediastinal area, and we're pressing it against the thoracic vertebra. We have 12 pairs of ribs. The first 7 pairs are called the true ribs. The last 5 pairs are called the false ribs. The first 7 pairs are called true ribs because their cartilage, this is called costal cartilage, not coastal cartilage, this is called costal cartilage. The costal cartilage of the first 7 pairs of ribs joins directly with the sternum. The last 5 pairs do not join directly with the sternum. If you can see these 3 pairs, the first 3 pairs of the false ribs join onto the costal cartilage of the lower true ribs. The last 2 sets of the false ribs are called floating ribs because they don't have any costal cartilage and they don't join anteriorly with the others. So we have 7 pairs of true ribs, 5 pairs of false ribs, and 2 pairs of the 5 are called floating ribs. There's a bone superior to the manubrium. This is called the hyoid bone. It's in your neck. And the hyoid bone does not articulate with any other bones. It's held in place with other muscles. So we have the hyoid bone, manubrium with the angle of Louis, body of sternum, xiphoid, 12 pairs of ribs which attach to the 12 thoracic vertebrae posteriorly. The first 7 pairs are true ribs, the last 5 pairs are false ribs, and the bottom 2 pairs are floating ribs.